Okay, this is the Board of Health meeting, Thursday, 6 p.m., May 19th, 2022. It's being recorded, and present at the meeting is Sue Braska,
Mackenzie Kane.
Lindsay Kane. Our new member, Jessica Baldiga, is not with us, not sworn in, or we haven't heard what her status is. Also, we have Alex White
Hey, how's it going?
and Tom Fitzgerald. Asked that both of with us because I thought Jessica would be here and then she could meet everybody. So what's our first thing? Public comment. Peter, any comment or anything?
Not this time, thank you.
No, okay.
And then
Minutes.
We're also joined by Valerie Bird. as
Oh,
well.
Valerie, you're on too?
Yes, she is.
Okay. Cindy, the minutes, you're the ones that I gave you to correct.
Yes,
I left them,
they were corrected, yes.
all right, and then these are the minutes here.
Yeah, I emailed them to you about 1 o'clock today.
Oh, how does that work?
Okay.
Mackenzie, do you have did you send it to Mackenzie too? Yes.
Yeah, everybody.
Mackenzie, did you get to look at the minutes?
Yes.
Do you have any additions, corrections?
No, no objections.
Okay. And you looked at them, Alex and Tom, you're looking at them now?
Yes,
Yeah, I circled the ones.
I have a question.
So perk test, it's percolation, so it's PERC, not PERK.
Actually, in the first paragraph, the new owners are looking for a special permit for the sewer. I don't recall that discussion. There's,
You have the map out.
what was that?
You have the map.
Right, but they weren't looking for a special permit for the sewer. They have a sewer there. So I guess that's my question. I mean, the new owners are looking for a special permit for the sewer. They're looking for a modification for their special permit, but not as it relates to the sewer.
Yeah, something, the overlay or something.
Right, there was a modification,
Yeah.
but it wasn't for the sewer.
Right. What do they need a special license for? The boat or something?
Special permit.
Oh, the docks, okay.
So I guess we'll have to make, because Mackenzie will have to sign the minutes too. She's not here.
I can just bring, if we're all gonna be here for the next meeting, I can just bring the book with all of them that haven't been signed, because there's a
Okay.
few in there.
Yeah. I think sawgrass is 2 words too.
I tried to keep, I kept trying to put it as 2, but it told me it was wrong.
Really?
I'll just put it.
Well, it wouldn't be a capital I don't think, anyway, if it was one word, if it was one word, grass, the G wouldn't be capitalized, I don't think.
So Mackenzie, I make a motion that we accept the minutes from May 5th with corrections.
I'll second that motion.
I'm in favor.
Mackenzie Kane, yes.
Thank you. I don't have to keep looking at you. I can just look right there. Right? Yeah.
Do you want this one up?
Is that one working now?
Question. I think to shut it off.
Okay.
Oh, sorry. Anyway, proceed. Next year. I'll let Jim know.
They're asking for modification, but not. Sure.
So Cindy, I made a motion to accept the minutes from May 5th with the corrections. And Mackenzie seconded it, and we're both in favor. Mackenzie abstained from the votes for the minutes.
She wasn't present.
Oh, so she didn't abstain, she just wasn't present. So
She was present, she was on.
No, I abstained because I wasn't there to review them.
Oh, all right.
I didn't have them emailed to me, so I couldn't say yes or no.
Did Jean say that that was okay? Didn't matter? You didn't,
Because it was a quorum.
no, but it didn't matter whether you were
Because
at the
it was 2 of
meeting.
you,
You
you
could,
and Jean.
didn't Jean say something that didn't matter whether you were at the meeting or not? You could still read and approve minutes?
No, I
You're
thought
not
she said
familiar.
that she had a.
I didn't physically have them to look at, so I couldn't.
Oh, okay, that's why. All right.
Yeah.
Might want to put the reason why. To add that there. Okay, I don't have the agenda in front of me, so
COVID numbers, I think is the first.
with, are you there?
Resident,
Is she muted?
Doesn't, so. Valerie, are you muted?
I'm here. I don't know why it says resident, but I am
Sorry, I'll
not
fix it.
I'm resident. I'm Valerie. Yes, I am here. And I would like to give you the current numbers for COVID.
okay.
Let's go, if you have a minute, let's go back to March. March, we had 34 confirmed cases. In April, we had 78. So that's a significant jump. And in May 1st through 19th, so far we have had 82. So that, again, it is another jump. 82 confirmed cases. We've had 15 not vaccinated. We've had 23 people over the age of 60 and only six under age 18. So most of those people are in between 18 and 60. This is only the numbers that are reported in Maven, which are people that have gotten PCRs. So if they have an at-home test, I have no way to confirm that.
Valerie, they don't say anything about people that have been boosted or anything like that? No breakdown?
Some people have been boosted. If you haven't been boosted within 6 months, you're considered unvaccinated. So, and the numbers that I
Not up to
have
date.
are not numbers in MIIS. It's just numbers that when they get their vaccine, hopefully at CVS, they put the numbers in. So we're relying on that. The majority of those people are boosted.
So you're saying if people didn't get a booster within 6 months?
6 months, within
Okay.
6 months, then they would be considered unvaccinated.
No, you mean not up to date?
Yeah.
Not up to date, not up to date. I'm
Not
sorry.
today, okay.
Yes, correct. Not up to date. They're not up to date in their vaccinations.
How about if they've gotten one booster and then it's been 6 months before they got the other booster?
It's still the same. They're considered not up to date.
Yeah, because not everyone is eligible for the second booster yet. You have to be 50-year-old or immunocompromised with that. So.
Any other diseases, Lyme disease or hepatitis?
Yeah. Yes, there's been 4 hepatitis C cases in the last 6 weeks. It goes back a little bit further. There's been 4 cases, and those cases are not pediatrics. I know there was some information out in the news saying that children were getting hepatitis C. This is not children. These are adults. And we've had 4 cases of influenza, and we've also had 4 cases of tick-borne illnesses. We have had 1 case of Lyme disease. We've had a Rocky Mountain spotted fever, and we've had 2 cases of anaplasmosis.
Yeah.
And we've also had, recently, we had a case of Streptococcus group A, which is, it's a bacterial pathogen. It causes cellulitis and sepsis. So this person that has this Streptococcus group A, she's in the hospital.
Well, obviously it wasn't in her throat.
And she's also 85. So hopefully she'll be able to turn around.
You know, the hep C, do we know, is it all one family or?
Nope, it's different people, and it's not all, it hasn't been one every day. It's been one every couple of weeks, and they're different families, different addresses, different age groups, but they're all over 20, and the oldest one was 63.
Wow. Okay. Any, Tom or Alex, have any questions for Valerie?
No, I'm all set. Tom?
Comments? Cindy, did you get everything?
What was the other, like the first to last case of the tick-borne? It was after the Rocky Mountain spot fever.
The anaplasma?
Yeah.
ANA.
Anaplasmosis, human granulolytic anaplasmosis. You've had a couple of those cases.
ANA, PLA, SMO. MOSIS.
Actually, do have a question. Schools, anything going on in schools that we should be?
I have not gotten, through Maven, I've not gotten anything through the schools, but through a previous Board of Health member, I've gotten information that there has been clusters in Woodland, Powder Mill, and the Southwick Regional School, but those people are doing at-home testing. So I don't have that information. When they're doing at-home testing, I have no way to follow up on those cases.
Valerie,
I only can, go ahead.
I'm sorry. Do you know if they're the school pool test, the pooling testing, are they reporting that to Maven?
No,
Or not? Okay.
they are not. They are not, because I've only had 6 cases under 18 since May 1st. I've only had 6 cases, and I know there's 3 outbreaks in both Woodland and Powder Mill.
Should follow up.
Maybe we should follow up on that.
Yeah.
I'm gonna follow up with schools and,
School, yeah, especially the,
you know,
school nurse, the head nurse.
Do you have a contact there?
who is the school nurse, Val?
Marcia
Lamro.
Lemieux,
Lamro.
Lemieux,
LAMOUREAUX.
thank you.
And her office is at the high school, at the main office, and then she goes to all 3 schools?
I have her email address, plus I have her phone number. So when I have a case that comes through in Maven, that's a child, I notify her.
Okay,
Can you?
And she will in turn tell me that, oh, that person or that child has 3 other siblings and they are all positive as well. So a lot of times she knows as well.
okay.
Can you email that information to Alex?
I
You have his-
can. Yep.
Okay.
Great. Thanks, Val.
And I had a question, but I don't remember what it was now.
About the schools.
I have a question. The public who's testing at home, and if they come up positive, have any of them ever contacted our office to say that they're positive?
Not to my knowledge.
Okay. All right, any other questions to ask, Valerie?
No, nobody has contacted me from your town that has tested positive at home, but they
No.
still should all be, if they test positive at home, they should stay home for 5 days. And then if they feel better and they have no fever, then they can go out into the public with a mask for an additional 5 days, as long as they feel better. So I don't know if you have a website you can put that on, because people are not contacting me, at least not from Southwick, they're not.
And they have to be vaccinated, yeah, following the DPH guidance in that regard for the general public, right?
Yep,
Yeah, we have it, our website on Fridays.
Good.
We have been updating that. But on
I'm not
Fridays,
familiar with that,
Yeah.
but do you want me to start doing that too?
if you could.
Sure, yeah.
So, Tom, then Alex would get the information to Jim?
Yeah. We have
So-
posted the monthly numbers from the EPI that we have working, Mary Thomas, Dr. Thomas, with the Tri-Towns, Southwick, West Springfield, Agawam. She's working with us, and they were doing the outreach during the COVID, during the height of the COVID. They still are. But she provided us with those bar graphs for
Oh, that's
every
right.
month, and she'll, obviously it's mid-month, so she's not doing that, but we have that resource as well.
I don't know if you've familiarized yourself with what's on that site, what's on the Board of Health site.
No,
Why don't
I
you take a
haven't.
look when you have time
Okay,
to see what's on there and
sure.
what can be updated or changed or
Now,
removed. or
I'll give her
added.
I'll give Alex a contact for
From-
Mary Thomas, because she's
Oh, okay,
very
Tom,
knowledgeable.
okay.
Yeah,
Thanks.
she's an epi. Yeah.
Great, yeah, so we'll, if it's not up there, then I'll make sure that the up-to-date guidance for isolation and quarantine measures are there. So, okay, great.
You have anything else, Val?
that's all I have.
All right. Well, thank you.
Okay, I will sign out.
Okay,
Awesome.
thank you.
Thanks,
for the
Val.
update.
Val.
I'll see you later.
Oh,
Bye.
Mackenzie, sorry, did you have anything to ask her?
No, I'm good, thank you.
All right, okay. I see you're gonna take a look at the site.
Yeah.
Okay. Tom's report, Alex's report.
Oh, yeah, let's see. What's here? So going over septic. Looks like we did a, Tom, you did a sign off on 2 Tall Pines, 4 Pinnacle Estates.
Where's Tall Pines, is that golf course?
think so. Yes. we
And how
got-
about, where's Pinnacle Estates? All these new names. We need another map, an updated map of the town that has all the
Right.
city, streets and stuff. Is Pinnacle Estates there too? Do you remember, Tom?
Tall Pines is. No, I don't. You don't
Forest-
actually have to know where it is to do the septic
You
design.
know, I
You don't have
know.
to know where it is.
I
As long
know.
as it has all the information, doesn't it have to
It's
be?
off of South Long.
Is it four-stage coached or four-stage coach road? or-
4-stage coach road. Yeah. Coach, no ED. 4-stage coach road. We did a perk with Barry Searle.
And where's
and then-
that? Where's Stagecoach Road?
Where did we do that? Where is that?
Yeah.
It's in Southwick.
That narrows it down.
You're asking the new guy, man.
It's
I'm
off of Hillside,
off a hillside.
but it's, well, off of Meadow Lane, off of.
Okay,
Hillside.
it's up there.
It's up, okay.
Dolphins. And then a perk was done at 283 College Highway.
Must have been a repair.
Was that a repair, Tom?
Yeah.
Okay, and then we did a
Was
repair.
four-stage coach a repair?
Yes,
Yes.
yes, it was.
Yeah.
Yep.
Pinnacle
And
Estates was,
Three
those are
Dewitt's,
all new.
that's what's
News,
Three
Tall
Dewitt
Pines.
Circle.
Okay, good, sorry, DeWitt's.
and then we did 3 DeWitt Circle. Yep, that was repair. No, that was a new construction, actually. That was a new construction.
Dewitt Circle was?
Yeah, because we did 4 T-poles and 2 perks. Yeah,
Where's DeWitt?
that's the addition.
Oh, but the house is there.
The house is there,
Yeah,
but
so
they're
it's not
doing the
new.
addition because
Right,
of
but
the
that
change of
because
use.
That house, that street has been built up, so that's not, that wasn't raw land, it was a house there.
Okay,
And we're doing what's FI? Final inspection on Congamon Road. Certificate of compliance for 11 Falmouth, 2 Birchwood Drive. And then a housing inspection for complaints
Yeah.
for 33 Grove Street and 41 Fernwood.
what were the complaints?
Unsubstantiated complaints at this time, yeah. Something about, what was that? I got the notes here. 41 Fernwood mattresses and box springs. We went there, Kyle and I went there to drive by, and it was contained in one of those disposable units that,
Yeah,
you know,
bag.
it's like the bags, yeah.
And I went back out to 33 Grove Street, we got a
DEP
complaint from the DEP state on that, so that was unsubstantiated as well.
And then we had our booster clinic, or no, the senior center did,
Yeah.
right? And that was,
Do you know how many?
Along with us.
so Cindy and I just spoke, and 67 people signed up, 65 people vaccinated.
Good.
Yeah.
So
That's
good
good.
immunization.
So I think we should think about doing that again, or we should think about maybe having the.
And who did they have come in and administer?
So that one was through the state vendor contracted. That was Cata. What was it? It was an ambulance company from Somerville, but they have a satellite here in Holyoke or Springfield. What's it? Do you know, Tom? No, okay. But I think it was 3 hours long, the clinic, right?
Yes.
9 to 12.
12, yeah.
So I think Cindy is saying that she had no problems at all. You know, they're good to work with. So
So you want to do a, and maybe do another one in conjunction with the senior center? Or what do you think, Mackenzie?
I think it's a great idea. As long as they have the availability, we should definitely do it if that makes.
okay.
That was a yes.
Yes,
Okay.
if they have the availability,
Okay, yeah.
definitely great. Yes.
So we can do that.
Yes.
Now, how was that paid for?
It's not the state's paying for
Yeah.
it, so they're
No
subsidizing.
charge, yeah.
Yes,
Okay.
at this time, yeah. So, which is great, you know.
It is.
Because they're trying to push for the primary prevention strategy of making sure immunizations and, people are getting the COVID vaccine.
Oh,
so,
yeah, because
yeah.
you had mentioned something when I talked to you about doing
Yeah.
something else, so.
I think we should definitely
Yeah.
pursue that
Yep.
for the
Great.
general public.
Because
Is
it's
there-
like 6 months, get the second booster.
5 months for 5 months, I think, right now, after your primary series for kiddos. And same thing for adults too. I think,
Yeah, that'll be good to another one.
Yeah. So is there an option where we can have it like at like a school or something like that, like an auditorium or gymnasium?
Especially this summer coming up, we could do that.
Yeah. That's.
I mean, we
something
could have
that
it
we
here
could
as
do.
well. I mean, we could have it at town hall, but certainly we could do it at school, especially when it's out, when school's out. We could certainly talk about that.
Yeah, I think Cindy and I were talking about the way that we increase our reach, dissemination with advertising. The vaccination clinic, I think, is really important. So a few different strategies, I think, brainstorming, I think, would increase the numbers quite a bit. So
Okay,
I think robocall, doing flyers around town,
Social media.
social media.
was there a robocall for this one? I don't remember.
I don't think so, no. No.
It was primarily for the senior center. That's what I was thinking about, having something larger for
For
general
everybody.
population. So it was kind of contained, that other people could sign up for it, but it was originated from the senior center.
And then, Tom, you have a proposed Marino.
Yeah,
provision?
we discussed that last week, so we can cross that
We cross
out. That was
that
one
out.
we already had discussed.
So, have they done anything with the kitchen yet or anything? Have you been in?
I haven't heard anything.
No.
No, the architect was supposed to, when the building inspector Kyle Scott and I met right here with the architect and the owner. That was some months ago, to get a hold of them to take a walkthrough and find out what they're proposing. And now that Alex was on board, I was thinking that'd be great for him to come in with him. Kyle didn't have the architect's name, so we need to find out who that person is, their contact number for him.
Is this the
and
same
we'll-
one?
That's it. That's it. I don't know if that's it or not, but I'm sure our Lebec Associates would have their contact number, so we can talk to them maybe about doing something next week. I could contact the one of the people that are Lebec with their architect's name and do a walkthrough.
Hey, how's it working out? So Tom, you're here Tuesdays and Alex is here.
I'm here all days, other than that, yeah. And I come in usually Tuesdays afternoon.
Yeah.
We interact and get up to speed with everything. It's working out so far. I think we're gonna start giving Tom some more of the septic stuff on Tuesdays, if you know.
Sure.
Yeah.
So what do we,
That'd be-
how many plants came in?
How many plans came in?
You
Oh,
said
boy, I
there's a-
don't even know.
You said there's a lot of septic activity, so what, protests?
Oh, yeah,
plans?
and then I actually just did one yesterday with at 20 Gableview Lane or Drive with that was a repair perk as well. So,
Gable View, 20.
yeah,
Those repair?
yeah.
That was signed up.
Because that's pretty new.
Yeah, 2006.
Wow.
Wow. I wonder what the
That's at the
sale-
ranch. right?
That was the infiltrators, they said.
That's at the ranch.
The ranch, yes,
Yeah.
right there by the
It's
college.
an
That must have been
infiltrator-
early one, 2006, boy, that was early.
Is it infiltrator system?
It was, yeah, it is, yes, yeah.
Okay, so why did they do the infiltrator?
Well, back then, everyone was doing infiltrators, right?
Give you a 38% reduction in size. Fairly
Because it didn't work,
efficient
huh?
to install. And it's,
Well, it did work. I mean, it
Yeah.
could be
Right.
a myriad of reasons why it failed, or, why it's lack of compliance. It could be maintenance or
right.
various
it's like,
reasons.
you know,
Yeah.
Chemistry, paint, and something that,
Okay, Magnolia Estates, that other one up on Hillside, where was it, what was there, 6 or 8 houses, but all the a lot of wetlands and the perks, some of the perks were too
Yeah,
close to the wetlands by the house. Have they
I
revised
haven't seen
anything?
anything new, but I did send a email to John Goddard from Planning Board. Informed they're gonna have to do, probably likely have to do some more perks because where they showed on the building envelopes, some of the perks were too close to where, of course, when we did witness, I witnessed perks down there, but that was just woods. That was long before
Yeah,
they did anything about where they're gonna put the house and things like that. So that's not totally unreasonable. Nobody would have known, but there's a lot of water there.
and conservation got a set of plans too, probably, right?
Oh, absolutely, yes. And it's just a preliminary, so they're gonna have to, find out what they want to do and how they want to change those locations, if they still want to go with that plan or make modifications to it.
Okay. For the grant,
Oh, yes, the Public Health Excellence Shared Services Nursing Grant. Met with, went to the quarterly meeting with the state and myself and Tammy was on there as well. And then went to the monthly meeting with all the grantees the following day. And there was discussion about, let's see here, discussion about buying some COVID funds that they allotted an amount of $9,000 to obtain COVID tests through the state omnibus, bid system. And we would have to use that by the end of FY22. So by June 30th, we would have to order some and use it.
we'd have to order them and order them by June, or pay for them by June.
30th, yeah.
But the kits are from the state.
The kits are from, I think it's the iHealth ones. And so you would buy it through the state contract service that they have on the omnibus as a bid service. And I think it's like $20 a test or something like that.
How much money could be allocated to that?
$9,000. So that's in addition that the state's gonna be providing to the grantees.
Oh, that's in addition, because we already
In
have
addition,
some
that's right.
COVID related money that's still.
That's
sitting
right.
there.
So this is only for buying COVID tests.
So the state is going to give us the money to buy it.
That's the plan. It was just mentioned, but they said that they're still working out the logistics as to provide that monies, but I don't really know.
Because
When's the next meeting?
The next meeting is going to be a month from Wednesday. So
That's not, yeah, we need to get an answer before that.
yeah, we only
And,
have 6
And
weeks.
also,
I'll get in contact with
also
them.
you want to think about getting these tests, how we're going to distribute them and to whom.
So the next meeting is June 15th.
Oh.
So I can get in contact with the person, Jeremy and
King,
what's her name?
Rachel King.
And Mona
That's a new name.
Intola.
Yeah,
Intola, I
that's
think
a
is
new
his
name.
name. Yeah,
Rachel King was the one I was working with.
right. So I'll be in touch.
And
with
I
them.
think Tammy Spencer was on that call with you.
Yeah, she
right?
was.
Okay.
Yes, she was. Yeah.
When you distribute them last time, I mean, how did that work out? Did we get any feedback?
Well, just the people that didn't, that came in, they were gone.
Well, no, remember
So-
would you give it to the
Like
schools,
even a lot of
senior
places,
center,
churches,
libraries, yeah.
yeah.
And did we get any feedback that people,
Yes, people called and said they wanted some. Yeah, there's never enough, but yeah. So that's.
The feedback was the places that we distributed them hoarded them and didn't give them out to the public. They kept them for like personal use.
their employees and stuff?
That's the personal feedback I've experienced when I went to one of the sites saying, hey, I need a test. And they say, no, we don't give them out to the public. We use them for our employees.
Oh. We might have to rethink that.
Well,
So I was
We
thinking,
gave to town hall. We gave
well,
to-
that's what I was
We
thinking.
gave it to other places
would-
that are
I was
for the
thinking we would do
employees,
it
we gave it
for,
to the employees in town hall.
exactly, because you want to make sure the town is still operating in
Yeah.
order to provide the services. So I was thinking departments, you know, who are COVID facing, so EMS, police,
And they got them,
fire,
and I think they also have opportunities to get those themselves, the police departments,
right.
in Massachusetts, but that's something you want to think about next time, to get this, you know, through the 9,000.
So it was given to businesses last time, is that?
You know, variety of the town employees, town hall, police, fire. And then we went to senior center, library.
Churches.
Yes,
So all the municipal offices, okay.
How many are they talking about us purchasing for $9,000?
Well, I did the calculations, and it's like, I think it's like 400 tests or something, so it's not very much. But each test kit has
two, right.
two cells.
But if they're giving us the money to purchase them,
Right. And then for campground, I don't know if you saw that message, but the state's also giving, DPH is giving to camp operators the option to the same thing, you know, of getting some COVID tests for recreational camp applicants in their camps that they're going to be holding for the session.
Mhm.
So I don't know if we should reach out to any camp operators that
Two.
so maybe we should reach out to them because I think they had to fill out a survey and then the Bureau of Environmental Protection responds to them.
do you have the information where they're supposed to contact, fill out?
Oh, yes, I do. I have that email. I can forward it to the camp operators if you
Who do
want
we
me
have,
to.
La France, and then the new ones up there on the side of
Side of
Mountain?
Mountain, right, that's it, right.
Okay.
Do we,
I actually just do a pool inspection at Sodom Mountain.
do they have like an email or anything?
Yeah. So I'm in contact with the manager over there, Stephanie. Yeah.
So what you're saying is they're able to get those kits at $20 just, or are they gonna get?
So
funded?
they get it
State's
for
gonna
free.
get-
So the
they-
state, so they just
Oh.
put out the request. Hey, we need X amount. And I think-
Excellent,
I think
yeah.
there's a cap. I think it's like 1,800 or something like that.
Wow, yeah, that'd be,
So-
yeah, that's certainly.
So I think,
Sure.
Do we have La France's email somewhere in the
No, we can
files?
get, we have a permit application. There's a
What is her
pool.
first name, Janice?
Yeah.
So the
Yeah, I know we
Janice-
have it. So
La France
that's no-
and
that's
then
no
that's Sodom
problem. We
Mountain.
can definitely get a hold of it. Yeah, that's no problem.
Yeah, because if you had that information, you could just. Let them take it from there.
Is
I
the
get so many
campground,
emails.
is the other campground that you went up to on Sodom Mountain, is it, they retained that name or did they change the name?
I have no idea. It was, the name still kept the same, yeah. I don't see any change of ownership.
Do we get a copy of their septic plans, even though it's DEP?
Well, actually.
Yes, we are.
Alex-
Yeah.
Yeah.
So I talked with her, yeah, so it says right here, tests will come in multiples of 180 with 2 test kits per kit and 90 kits per box, and camps may order up to 1,800 tests. Recreational camps and programs may request a one-time distribution of the test by filling out the survey, and it's due on June 3rd. So
These are regular campgrounds and recreational camps?
yes, no, it's only for recreational.
Okay, well,
camps.
those aren't recreational.
Oh,
Those are
no.
campgrounds.
Okay, so we have no recreational camps?
We
for
do.
Southwick?
Um, Yes,
Wilderness experience.
yes, and that's being, I understand that's changing hands, but ironically that we inspect them, but the actual facility is in Westfield. They have a presence in Southwick, they have a pool in Southwick, but they're actually their rec camp is not in Southwick, so it's kind of a hybrid. I've always done the inspection and done all the paperwork side of it, but the actual, where they bring the kids to do the recreational camp thing,
Oh,
is in Westfield, with the exception of the pool and the ropes course in the back, which is inspected by the state.
cool.
I understand, as I said, they're changing hands.
Great, so I can send it to them.
You said it to them, right? Yeah,
Or I can send it to Westfield.
it's at their house.
Yeah.
The cooks
We have no other ones.
at rec camps.
So they're getting a grant or they're getting money to purchase them.
No money, they're getting the test kits directly from DPH.
And they have to pay for them.
Nope.
No, they get
No, no,
it
no,
Oh,
free.
they don't.
They get it for, so I think what happened
charge.
was that the state paid for the tests through the omnibus system, and then they're just distributing them. That's what it sounds like.
But that's different.
That's
than
different for us, yeah.
Okay.
Well, we gotta pay.
But we're
But
paying
even
with their
though you
money.
guys got a whole bunch for free, right, before?
Yes.
Yeah, because we were one of the communities that had the, according to the state, lower income community.
Wow.
That's why we got the last batch.
Yeah, I'll follow up with the state about this. Grantee.
Okay, the,
And then,
anything you want to ask McKinsey, have anything to add?
No, I'm good, thanks.
Tammy and I were mentioning about increasing our reach for the nursing job description or the job posting. Currently, we have at the Massachusetts Health Officers Association Job Board. Tammy was interested in reaching out to Phoebe Walker to get that posted on the Western Mass Public Health Association. And then there was talk about the Massachusetts Municipal Association, and then the Massachusetts Public Health Nurses Association as well, job board.
I checked them with Joey and it is on there.
So I don't know if we should expand that.
McKinsey, do you know of anybody who's interested? Do you have any contacts?
No, honestly, not really.
We might want to consider, raising the rate.
Raising the rate.
Yeah,
Sure.
for the,
What is the
Nurse.
current rate? I don't even know.
it's in the contract and I sent that information to Amy a while.
Well,
It's in the
really-
job description, actually.
We really can't raise the rate because then it's going to take away from, we got the two positions, right?
Well, the alternative is what?
Nothing,
So that's something I think we should discuss
unless we
with
cut down
DPH.
on the hours.
Huh?
Unless you cut down on the hours. The time would be 30 hours instead of 37.
I've talked to people at MHOA and they have, statewide, there's problems getting employment, getting people. It's not just nurses, it's positions like ours. And I think McKinsey could address it as well. That the field is pretty
Yeah.
tightly wrapped and difficult to find people that want to do this work right now. Partly because of COVID, but, partly because of the economy. But I think since we're not getting any action, and we've got a statewide job descriptions out, and we're not getting any response, something's got to give. Now, one of them is, I agree that we could increase, expand the outreach. But also, I think we should consider increasing the pay.
Okay.
Want to look at the numbers.
I mean,
We only have
we're
some.
pretty competitive
With who?
compared to other job postings with the nurse. New grad pay. I don't know what that is.
Yeah. We posted.
30K?
Yeah.
Oh, wow.
Yeah.
Is that what it came
I mean,
out
we
to?
were,
Remind me what the starting pay is in the job description?
Yeah.
I remember you.
Does anybody know?
yeah, I think it was
Close to
37.
New grad.
$37 an hour.
For
We
the
were
full-time?
constrained.
Well, that's
Are
We were constrained by the.
you interested, Mackenzie?
No, thank you.
I think when we looked over it, you had thought it was pretty fair.
Yeah, I mean, new grads entering the field are making low 30s.
Yeah, so.
We were constrained by
Right,
the grant.
exactly,
That, you know,
right.
that was built
There
into the
you go, yeah.
grant. So that's
But
what
I
we
do
had
want to
use.
note that I was talking with I don't know, the grant leads or whatnot for our section, that there is going to be a capacity needs assessment, come in FY23 to evaluate whether or not we need to increase our capacity. And I think there is talk that that could also be a potential for increasing the services rendered, so we can, increase the budget amount if we need to, or, hire someone else at a different role or something like that too. So that's something to also consider as well. So
If we can get anybody.
I know that's the biggest, I mean, that's what the Department of Public Health was echoing, is that it's out there, but no one is taking the bite. So
What was the other thing that we have to return the money if we don't use it
that's
for
correct.
the end of, for this fiscal year?
And then we get the money back on.
Okay, so we have to return what is left of the money?
That's correct. Any unspent allowances, or, we have to go ahead and return. I don't know how that works. I
Okay,
don't know
so
if it's,
yes, how does this work? Because the administrative part,
yeah, I mean, Department of Public Health was telling me that they would be in contact with me to let me know the process by which we go about the returning of the funds for FY22 unspent, but I don't even think that they have a game plan, but I don't know.
Again, we're not the only ones in this position.
Right. Oh, yeah. There's a lot of other grantees who are scratching their heads. Been doing this,
is there anything then that we can use that for that part of that money? Is there anything we
Yeah,
can
we
buy?
had COVID, there's some money in there for COVID besides what Alex was already talking about.
Yeah, so it looks like we can buy some of the durable goods. Like there's a laptop. Office supplies, looking at vaccination services. So I can start looking at some of those items and working with just get that.
We have to do this when, by the end of June?
Yes,
Okay,
But then it
because
would,
if we don't use it, we
it would
lose
turn
it.
over, yeah,
Right.
but it would turn over, but we would turn over again. And get the new.
so then at least we could have that stuff ready.
Right.
All right,
I mean, I've never really heard about, giving money back. You get a grant. How this one's working. So, it's
Did we
interesting.
ever- Jessica, I forget back to you and who our doctor is?
Yes, Cindy told me.
Beltran.
Beltran, we got a Bay State doctor floater.
Yeah.
If it's not Beltran,
It isn't?
if it's not,
Oh, if it's
If
not.
it's
It
Oh,
is, I think it is.
a Bay State floater, if not Beltran.
And when did
Doctor.
Jessica say when we have to renew the,
that's what I was trying to find out myself. I don't know the answer to that.
I don't know the answer to
We have
that.
to- we have to find.
do
out
we
the
have a,
contract.
do we have a folder?
Yeah, let me go look. It
Beltran or-
was somewhere.
I mean, Listen may have had it, but now Cameron's in there, so. It's fine, but yeah, we did have the contract.
All right, so we gotta get the doctor. States.
I was curious to know if the board would be interested in having me pursue, like, having our own vaccination clinics. I know that the state was having free vaccines, but now they don't do that. But if we do get a public health nurse, if they can provide those vaccination services. And we can hold our own clinics here, and then we can go through Commonwealth Medicine to get for vaccine reimbursements. And go a little bit above breaking even. We can funnel that money again.
Now, do you mean in the future, once we get a nurse?
Yes, but I can go ahead and try to set up, making sure that, you know, we're all set with that. My S system with the color program, with all the vaccination services at the state level that we need to have as vendors to be approved. If we do
I know in
provide
the
those.
past,
Yeah.
we didn't do flu. Offered them. People can get flu shots
Right.
everywhere.
It's true.
So we didn't have a good turnout.
Even when we had the COVID test clinic, we didn't get a good turnout for that.
We were testing.
The PCR, the curative
Yes.
one? Okay.
Yes.
It seems like when we have had clinics recently, it's been with senior center.
Right.
So we
So,
haven't done it on our own. We've done it in conjunction
Right.
with the senior center.
so are we providing the same kind of outreach, flyers, robocalls,
For what?
social media, for all those kind of activities for the community? Are we just
No,
curious?
we haven't done the flu vaccines for the reasons that Sue just mentioned.
We didn't
We
get
just,
it.
there's not a crying need in this town. Typically, in the past, there hasn't been. Because
Okay.
it's so, there's 3 pharmacies in the town that provide those. And it's along with the senior center, the people that, so there has been opportunities for that with the senior center, and we work in conjunction. I know that Amy
The
did
senior
with
center,
it.
we haven't had clinics.
Yeah, so they did have it with that, but just like we did with this, the booster clinic was an example. It wasn't just for seniors, but it was, you know, spearheaded along with the board health with the senior center. So we have done it in the past.
Yeah.
Yeah, but I'm just talking about outreach, like what's our strategies? What have we done in the past? Done robocalls to the public, to our residents? Have we
Trying to
done
think,
flyers and stuff like that? Just other dissemination tools that we could use.
yeah, robocalls would be good. Did we do a robocall for something? I don't remember what it was. Was it the curative? Up at the schools? Do you remember,
I
Mackenzie?
wasn't,
If
I
you did
wasn't
any
there. You
weren't
robocalls?
there.
I was,
Okay.
yeah, I wasn't involved. in
Yeah,
that.
Curative did their own robocall, yes.
Yeah, must have been a robocall.
So that's something that if the board start doing. If not, then you know, we can. Just trying to think of, do we have like a dispensing site or medical reserve for anything like that, volunteers and that?
We did
Had
it in
one.
the H1N1 way
Yeah,
back.
we had one back then, yeah. And the Hammond County Health Coalition, which you went to the meeting on.
Right.
They have various chapters of the Medical Reserve Corps.
Okay.
I know we were part of Westfield's Medical Reserve Corps several years ago.
Mm.
So we could certainly look into doing that, because it's called the Greater Westfield Area Medical Reserve Corps. And another option would be, now you're involved with the Hampton County Health Coalition. I think that was on the list of things that one of the meetings you attended.
Yep.
They're looking for partners as well, for some towns that already have a regional medical reserve corps.
Okay, and we're part of one with the Greater Westfield.
Yeah, but I'm not sure how active it is right now, but the ones, the Hampton County Health Coalition, they have some more viable options.
And have there been like trainings or anything like that with the MRC or with
Yes, there are.
BDS?
Yeah.
Okay.
Yeah.
This here was the positions folder. And Cindy opened it. This is here to see whether we paid. We got a bill.
Oh, my goodness.
It's 300. So the question is whether we paid it or not.
We can find that out.
Through downstairs, through Laura?
Yeah,
I'll do that.
All
or,
right, so-
or
I can
Cindy
talk to
can
them
do it.
tomorrow.
Or Cindy, okay, so we'll give you this.
Well, they have a vendor number.
Mhm.
So I think,
Well, we had it for years. We've been doing that for years, but
And then it must go. So we'll be renewing it or whatever come or sending another.
yeah,
But
So do
this
we
came-
pay
this
ahead of
came from-
time, or
This
do-
came from them, I guess, right?
that did. And then
Yes.
this is, it looks like the information that someone filled out. Jessica, I don't know who she is.
Jessica used to be our other secretary
Oh,
for
okay.
Cindy.
Okay.
So let's see whether we paid it and then,
Yeah, I'll follow up with Laura.
and it's got a name, Aaron. I don't know if Aaron's still there.
And Mark.
And they are
Yeah.
marked.
yeah, she was the one we were involved with, yeah.
No
Getting that to
problem.
go.
In fact, yeah, well, Cindy will check.
Okay. Oh, you will? Okay, sure.
Cindy's gonna check to see whether we paid it last
Yeah,
year.
just shoot me an email. Let me
And
know.
then- and then-
Great.
I know you guys obviously didn't get to look at the well regs.
No, I didn't.
No,
No.
it's too much going on. The septic regs, you find out about posting them and
You haven't got a final sign off from everybody, have you, from the board? You want to wait till the new board member gets on before you?
well, the septic regs, we don't vote to approve them until we have the
Hearing.
public hearing. And we post it and all that stuff, that whole procedure, but I don't have that, I don't have the protocol.
Well, I told you, yeah, I think I
Yeah,
gave you
I-
a copy of that, but I'll give you another copy because I do it. The
you do the
Yeah.
protocol? You write yourself a note so you remember, because I know you're real busy too.
We just have to post it ahead of time, but I was talking about the actual document before we do anything. Is that document been cleared by everyone?
Yeah,
It's been cleared through legal?
No, not so much that, I was us, I mean, the board.
Mc-
With the
McKinsey,
new board coming in, that's what was the reason.
Yeah, who's the new board member?
did you get to look at the revised septic regs that we really toned down?
I remember talking about it, but I can't say yes or no whether I've
right, I'll
approved it
send
or
it.
not.
I'll send them to you, because I know we discussed it. I don't know if you were at the meeting or not. I don't know if that's the one that you had.
Right,
on
and
your
you and I
desk.
went through it,
Yeah.
but we haven't got a clear copy of that, though, have we?
Yeah, I have one at home.
Oh, okay, so maybe for the next meeting. we can
So,
nail it down.
okay.
Yeah,
And Alex looked at it too. You looked at. 'cause you
Yeah,
showed me
yeah, I
it.
had a few
Huh,
questions, but
yeah.
it was answered, so yeah. I think we did agree
Yeah,
on
we
it.
we
didn't
did it the last meeting, I think.
Yeah,
yeah, but I don't think it was ever voted on, or even to
Well-
proceed with it.
Yeah, no, it is. It's in the minutes. It's in the minutes to,
The
that we
final one,
yeah, that we voted to go ahead and forward it. We made a motion.
Sue made a motion to go forward with these regulations by posting them and having them public hearing as we go forward with adopting these regulations in accordance with the procedures. Jean Nilsson seconded the motion, and the vote of the board was unanimous in favor.
Okay, so.
And then a roll call.
All right, so we can go ahead with it.
So what would you like us to do, Tom?
I'll just make sure that all the board members, especially with the new board member coming in.
So should
That
we
was the
wait?
only thing, well, I would assume in 2 weeks that person's gonna be on. Eating, right? And just-
Yeah, but I'd like to get it, I'd like to get it going,
What's-
because we did approve the
Right, but it's
past
been,
members.
we've had the other ones there for several years. I don't know if it's 2 weeks is gonna make a big difference.
Yeah,
And
it's
to
been
have the
20
other
years,
board member-
right?
Right, well, that's kind of the point.
It's been over 20 years. Okay,
But Alex and I can actually go through the well regs next week.
I think so.
Yeah.
It's
I
just a
can go
lot.
through.
though,
we have
isn't it?
time because
They're
they're
much more,
huge.
they're much
It's
more,
much- Stringent.
they're much more stringent than what we've had, so
Yeah.
so I think we need to think about those, because it's gonna require a lot more work than what we do now.
We have to have an equitability lens
Yeah,
too, you know,
right.
just making sure that it's,
Right.
it's best for our environment. here.
Yeah.
Yeah.
You, done with this semester, starting up the next one?
Yeah, I just started on Wednesday.
So you did start.
Yeah.
And Cindy, you're done?
Done.
Woo, done totally or
No, done until fall.
done until
Just
fall?
one semester.
Okay. All right.
And then you're done?
No, I'm gonna keep going.
You're gonna keep going, PhD, right, okay, good.
No, you'll get your bachelor's then in the fall.
I'm associate.
Or you associate?
And
You're gonna keep going. Yeah, sure.
MD.
Okay, so we have a title, we did the Title V conference, Tom? Alex?
No,
No, I went to it and.
What was that about?
What was about, well, I think it was, well, it was interesting. It was talking about different systems like the jet and the Elgin system and I can't remember the third one. And so it's just different. Oh, it was the Roth, the RMT
you make
tanks,
too.
the
They make
plastic tanks.
Yeah.
Oil
Yeah.
tanks.
And they, so it was just describing the components and the, how you go about installation and getting certified, you know, why it's the best and of the best. And so that was in Northampton at the Blue Up on it. Really good food, potato salad, delicious.
So who put it on?
So officially, Tom,
Tom?
you want to take away? I don't know.
Well, it's skip from underground supply, but the Western
is it
Mass
co-
Public Health Association assisted with it, because we normally have ours in the fall. But because
The
so many
totally
people,
Title V.
yes, totally Title V, but it's this was very similar in format, but it technically wasn't the Western Mass Public Health Association. It was, we assisted in registration, but the skip from underground supply was the one that was promoting it.
The
One of
second
modules was
component.
going to his shop, right?
And
Looking at his operation. So we're still gonna have another one in the fall. And actually, I thought that Alex would be a great candidate to be on that. We're looking for new blood, new young blood. Yeah, I'm trying to get a fellow from Westfield to be on it. Tammy's on the board now. So we're always looking for to help us out.
Absolutely. That would be great.
Okay, and anything going on with the coalition?
Yeah, I went to the, oh, when was it? That was 2 weeks ago or something. That was a good meeting. It was just getting up to speed about, you know, just a little debrief about what's going on with COVID and any new activities. Doing a partnership, like mentoring, shadowing program for health departments and seeing if anyone would want to be a candidate to chaperone or mentor. Talking about emergency preparedness. Yeah, that's pretty much it. And other conversations, you know. So it was good. It was nice to meet people, a lot of familiar faces, public health nurses, and Pioneer Valley Planning Commission emergency preparedness coordinator, planner, and Gail from DPH. So Tammy was on there. Jean Galloway. Yeah, it was good to meet new people and connect. So yeah.
Else?
That's
I don't have anything, no.
Mackenzie, do you have anything? Anything you want to say or add or ask or
Nope, I'm good, thank you.
what?
Should we talk about this?
What is it? Oh, yeah.
It's a side right next to me. Oh, and I went to the town meeting and the articles passed for the Board of Health.
Yes,
So,
thank you for going.
oh, it was good. It was short, actually.
Yeah, that's short.
So,
As a moderator, just move it along. I haven't,
yeah, she was great. Yeah. The whole setup was great. Joe Didi got, well, a bunch of people got recognitions and honors. And Joe got one as well for his service that he provided to the town. So it's nice.
but Tom, did we get anything back from town council about the letter?
No, we haven't. I actually reached out to them again. I know maybe because they were, and I CC'd Alex in that email.
This is getting frustrating, so what can we do?
We have to. What we're doing, we reached out to town council because we got some legal, issues about the regulations that we are doing it. But, and also, I've spoken to Joe as well as the other two select board members a while ago about making sure that next year, this year, we're probably on our own, it's past due, but for next year, for January, we have to be all in concert that no other permits will be given until such time that the Board of Health, and I think we can tighten that up.
But things like La Patisseria, what do else, other than from us, what else do they get? Do they? So that would,
Again, I think they, well, it depends on their size. Some don't get the fire inspection if they're
Liquor.
and building inspection if they're under a certain threshold for occupancy.
Mhm.
So I don't know, so we could check. I mean,
yeah,
Alex has access to the building inspector, so he could get an idea of which establishments that they inspect. I know they do the large ones, but I don't know, there's a threshold for, I think, square footage, how many people are in there before they have to go in and do the, the pin bar hardware, other.
all right, so Subway's not open, right?
Correct,
So Subway we can take off. Franklin House isn't open,
correct.
that we can take that one off. Sunflower Smoothie Cafe, they probably, because they had opened, may not realize they have to do it. What's going on with Edgewood? Is Edgewood serving food? Is it open?
We got a menu for them, but we have nothing else. You have that, right?
What kind of menu? No, I didn't see this menu.
Yeah, it's on.
Okay,
on your
I
desk.
thought they were going for a special alcohol permit for,
The application was dropped off today
for what?
for Edgewood for liquor license. I was down there.
Oh,
Okay, so therefore liquor license should not be
Give them-
Right.
given. Do they know that?
The select
Board
board,
of Select Board,
they know that, right?
I don't know.
We reminded.
Yeah,
Yes, could someone remind them
Yeah.
not to,
We need further evaluation before we
Not
can go ahead and
to-
grant them.
grant that until they come to the Board of Health and they square whatever they have to
Well,
square.
that they're
with.
in good standing.
Yeah.
right.
So Cindy, you're gonna do that,
We don't have
or
an
Alex, or,
Yeah, do we have that?
Do you want to tell Robin?
Well, absolutely, absolutely. Yeah. I actually just met the new select board, was Jason, right? And Robin came in the office. It was nice to meet them. So I'll talk with Robin.
because Joe Didi was very aware of.
Yeah.
So you're gonna be here tomorrow, Cindy? And you'll be able to,
I'll be here 8 to 1, 8:30.
right?
I'll be there.
Okay, and whoever we have to tell, or Carl, or whoever gives them out, or, all right, so that'll take care of Edgewood. So Gristmill's just missing their choke. An allergen.
Yeah, and Millie's, he keeps sending me
Who? Millie's.
Millie's country store.
keep sending you up.
He keeps sending me the wrong, he doesn't understand that the manager is different than the food handler.
The food protection
Right.
manager, right,
Yeah.
right. It's just along the course very much.
Yeah, and I sent him the link to take the thing, and he hasn't gotten back to me since the 25th of April.
Yeah, so I'll just like to see all the applications and I'll review them and,
Yeah, I'll get you the list tomorrow. with
I
Yeah.
all the
suggested
information.
again that besides the individual ones we're doing, would be sending out a letter, a cover letter with all noting very clearly,
like a renewal letter,
right, which we already do
right, as a courtesy.
as a courtesy, but also as a courtesy in the letter, indicate to them that, by a certain date, by January 1st, whatever, that these things are going to need to be in place. The
Right.
permits have to be in, the paperwork has to be in, the choke saver.
It's a
allergen
requirement
awareness,
for the
safe
application.
Manager certification.
But
all those
isn't,
things.
don't we send that out
Yeah.
already?
Yes, but if they're getting other permits in the town, in other words, unless we work together, we're not gonna achieve this goal. And so far, and it's partly because, we're not on e-permitting. And that's what I tried to
I
push
know.
for e-permitting, that we'd be all, we can still do it without it, but it just it would make it a little easier, but it's a little more expensive. I did speak to Doug Mogan about that last week, because I sent him the e-permitting module. And he said he's gonna be looking at it, but he thought it was a good idea, but obviously it's money.
How much is it?
It's like 11,000 first, and then it's 4,000 a year
Yeah,
for
it's
the module.
it's big. It's,
Yeah,
it's.
yeah, I mean, it's not
it's
insignificant,
absurd.
however, but there is ways to use revenue.
Hopefully, well, I was gonna say getting more vendors and more competition, but we already have it for the building.
Right.
With a certain vendor.
That's right,
Oh,
things that would be compatible, right?
Unless they come out with other competition that are compatible. So the ones on the top, the ones that owe us something, they've all,
They handed in
Paid.
applications.
and they paid, except, what is this $50 of Westwood Brewing?
That's been on there since Jess. I have the same list as Jess and I keep editing it as I get.
Yeah, but what is the $50 that we're short?
You give her their seating.
is that the fee or something? What is that, a late fee?
No, I think it was the $50 for, or are they adding seating?
Yeah, but that wouldn't be ours. Oh, maybe it would be, yeah, actually, it would
No,
be,
it
because
is.
we do have the size by the number of seats, so it changes, yeah, so maybe you could just check on that, because I know you weren't involved originally, but just kind of follow up on that.
Alex, did you get a copy of all the permits we give out and
Yes.
to who and what and how much
Yes.
they are? And
Yeah,
you got-
I
you got-
actually think it's pretty good.
You
Yeah.
actually get some.
You actually got that?
Not through the Excel sheet. I just went on the website.
Do you have access to the shared?
Yes, Jim gave me
It's on,
access.
it's on there. I can show you.
Sure, great. Wonderful. Yeah, the applications look good. Yeah, I think the fee schedule is pretty straightforward.
And Tom, you've reached out to town council again. We haven't heard anything. It's been about, what, couple months?
No,
No.
In regards to the letter finding.
the regulations related to fines.
Yeah.
And the repercussions of not, one of the issues along with the whole, the complicated finding structure that we have, which may not pass muster. That's,
Yeah.
if you look at the top part with the establishments that owe us something, the regulations never really address any repercussions of that. The only thing that regulations address financially for finding is if they don't pay their food establishment license. These people have paid their food establishment license, but that's nothing else. So that needs to be either clarified, updated, redoing the regulation, kind of like we're doing with the Title V regulations to tighten that up. But coincidentally, and concomitantly, I guess is the word I use, is by using, by having the other town boards as well as the select persons, making sure that no other permits are issued unless the Board of Health is satisfied, which we really haven't pushed in the past. But then again, we haven't had this much of a problem, and it maybe it's partly because of COVID. Last couple of years things have kind of deteriorated a bit.
When is this list created? Do you know?
Actually had it when I started. So started in March.
But it's still all this stuff if you were able to verify that stuff is still.
Yeah, you read it? Okay.
Yeah.
All right.
Okay,
Because I
Good.
haven't
Yeah.
seen anything. from-
right, and you're on top of it. Okay,
Okay, good.
so we'll solve this. Alex and you get this solved.
Cindy, thank
And
you.
you.
All you, Cindy, right?
And Cindy.
You look at me like, oh.
If it's right, it's up.
All right, anything else? Then, Tom, Alex,
We're having a lot of fun.
Mackenzie, anything else?
Nope, I'm good, thanks.
Any comments on this?
How you doing, Mackenzie? How you doing? I don't know.
How am I doing? I'm sorry.
How are you?
Oh, I'm good. I just keep getting exposed to COVID, so I don't want to expose
Oh.
everybody else. That's all.
Oh, is everything okay?
Oh yeah, everything's fine. It's just the kids, the daycare is rampant with COVID, so
Oh, no. Oh, man.
yeah, we keep
Oh.
having to quarantine.
Well, until we meet in person again, good luck.
Yeah. Thanks.
Okay, so we'll meet again the first Thursday in June. I don't know what date that is off the top of my head, but oh, I
What
know,
was that, the 1st of June?
first Thursday in June, the first and third
That's
Thursday.
June 2nd.
Now, question,
Me or Tom?
both of you,
Don't look at me.
or Tom, does Alex know like about the agenda, when it has to be put out and?
Yes.
We're working on it, yeah.
Yeah.
Okay.
Yeah, every time everything that,
Yeah.
every time.
And it
we're
went
together-
smoothly when we did it together, right?
Yeah.
First time.
Okay, good, and the Zoom connection and all that, because I don't know. how to do
Yeah,
that,
yeah,
so-
we just went, my login still needs to be adjusted accordingly. So Jim again?
Yes.
God, we rely so much
Wait
on
wait a
Jim,
minute, wait a
don't
minute.
we?
It may be,
Doug.
maybe,
Doug does.
yeah, that's right. It's not that, because it's a special, it's like a license.
Oh,
There's only so many people that have those licenses, and
He did
you could
mine
have
really-
mine. Huh?
He did mine really quick, within an
Yeah.
hour.
okay.
Yeah.
Well,
But if there's a set number that they only can have for license for this, for Zoom, then you can have mine.
wow, that is too kind. Thank you. Good. So I'll follow up with Doug. Was it?
Yeah.
Okay, Mackenzie, I'll make a motion that we adjourn the meeting at 7:20. A second it?
Yeah, I second it.
So we're all in favor, Sue, yes.
Kenzie, yes.
Okay. Thank you. We'll
Thank you.